Welcome to JATChat, presented by the Journal of Athletic Training, the official journal of the National Athletic Trainers Association. I'm Dr. Shelby Baez, an assistant professor in the Department of Kinesiology at Michigan State University, and I'll be temporarily taking over hosting duties from Dr. Kara Radzak on JATChat for the next episodes. Today, I have the pleasure of being joined by Dr. Jessica Wallace and Ms. Tamaria Hibbler. They are authors of Examining Concussion Nondisclosure in Collegiate Athletes Using a Health Disparities Framework and Consideration of Social Determinants of Health from an upcoming issue in the Journal of Athletic Training. Dr. Wallace is an assistant professor in the Department of Health Science at the University of Alabama, and Ms. Hibbler is an associate athletic trainer at the University of Arkansas. Jessica and Tamara, thank you both so much for joining me today. So just starting off, what led you all to examine concussion nondisclosure in collegiate athletes?
Well, thanks for having us today. So the purpose for this paper was really to do a parallel study that we did with the high school athlete population. So a couple of years ago, we collected some data and we published on concussion nondisclosure in high school athletes. And this has really been done widely by several researchers and scholars in the field of athletic training. And so we wanted to take some studies that we had previously done and do parallel work within the collegiate athlete population to see how things were measuring up, to see if there was any differences, similarities, and really these findings can help gauge future interventions, work in concussion nondisclosure, and clinical practice.
So you mentioned in the paper that one of the issues that you were wanting to explore as relates to concussion nondisclosure is this consideration of social determinants of health. Can you all just discuss what this means and what are some of the social determinants that are important to explore in this population?
Yeah, absolutely. So we know that social determinants of health are really where people live, work, learn, grow, develop, play. All of these powerfully shape health and health behaviors. So for this paper specifically, we employed the social determinants of health model by Drs. Braveman and Williams, looking at really 5 main factors, those being family socioeconomic position. Within the context of this study, we used free and reduced lunch status when they were high school athletes. Also race and ethnicity as a social construct, physical environment, so where people live, neighborhoods, schools that they attend, etc. Social relationships, so really who people are around, so their parents, their peers, their coaches, their aunts, their uncles, their neighbors, and healthcare access. And within the context of this study, we use access to an athletic trainer in their high school.
So many different types of social factors that could potentially be influencing concussion nondisclosure. So what all did you identify as relates to these social determinants of health and concussion nondisclosure in collegiate athletes?
Yeah, so even though these are really categorized as social determinants, some of them are very much structural determinants of health, right? So here we're looking at healthcare access in terms of an athletic trainer. So there are many schools, high schools within the US that really have very low access to athletic trainers. And so we thought this was one of the main ones to throw into our analyses and our models. So when we looked at this, like within our paper, we did ask them, and this was all self-reported data on a survey. We asked our student athletes, did they have access to an athletic trainer in high school? Just yes or no. And then also, did they qualify for free and reduced lunch when they were in high school? And so when we looked at these within our models, right, so we actually included 3 of the Braveman and Williams social determinants, race, socioeconomic position in terms of Title I's school status and free and reduced lunch, and then also healthcare access, so that being access to an athletic trainer. And what we found is that these did not lead to non-disclosure in collegiate athletes. So different from what we found in the high school athlete population, where The racial differences that we saw in the high school athlete population were very much driven by poor access to athletic trainers and Title I school status or free and reduced lunch status. We really didn't see parallel findings. And so for us, that was actually very positive. And so we kind of took that as, well, in the collegiate population, if we're seeing lower disclosure or self-reported non-disclosure, that could mean or be indicative of at the collegiate level when our student athletes have equivalent access to athletic trainers to report injuries. These are powerful drivers in mitigating and reducing non-disclosure in our collegiate athlete population. So very interesting findings and actually very positive that we didn't find parallel things that we found within the high school athlete population.
So access seems to be a really key factor in order to reduce concussion non-disclosure. You mentioned when you first started discussing some of the results, this difference between social and structural. Could you elaborate a little bit more on what you mean by the differences between social determinants and structural determinants?
Yeah, so in ways they are sort of blended together, right? So when we look at social determinants, a lot of these can be very individualistic, right? So measures. So for example, did you qualify for free and reduced lunch? That's more of an individual and a personal social determinant based off of a family socioeconomic position. However, structural is very, very much, or could be as a result of just what neighborhood that people live in, right? So in terms of what is available in terms of access. So for example, if there's no athletic trainer at the high school, and there's also reduced resources within the school, it's very hard for athletes to disclose and then get the care that they need for a concussion. So structural is more of, their environment and then also history.
Yeah, that makes a lot of sense. So along the lines of some of your results, what was interesting though is that you found that race wasn't associated with concussion non-disclosure. Can you provide some insights into these results? And you mentioned the previous high school sample and the collegiate sample, potentially making some connections between those two different populations.
Yeah, absolutely. So within this study with collegiate athletes, we did not find any differences by race in non-disclosure. One of the first things that we really need to be transparent about is this: we really had a very low number of Black athletes that reported non-disclosure, right? So making some of those parallel comparisons a little bit more challenging, right? However, I think that the authorship team, as we were really digesting these results, and we looked at race both as a confounder and an effect modification measure, right? So the way we actually measured it, still found no differences. And to us, this is actually a really positive finding. So collegiate athletes, having access to athletic trainers, more of a level playing field in terms of where they're living, resources at their fingertips, even socioeconomic resources. This is more so leveling the playing field in reducing the disparities that we're seeing at the high school athlete level.
So tying back to what you were saying previously, this access and seeing how fundamental access is to leveling the playing field to provide, to reduce concussion non-disclosure, I'm sure amongst many other different types of concerns that that our collegiate athletes may encounter. So what's I think it's also cool to highlight is that when we think about research, oftentimes we think we don't see a difference and that's a bad thing. So it's also really cool to see with this particular study that we can see these null results and it's actually very beneficial for us to acknowledge. So you all did find some differences as relates to race for specific, for reported reasons for non-disclosure. Can you all elaborate on what some of those reasons that you all identified?
Yeah, so two really big ones that stuck out within the research were Black athletes being more likely to report that they did not say they had a concussion due to, we assume, assimilating to their environment of, I don't want to look weak, I don't want to look like I don't want to participate. There was something about the team aspect of, they didn't want to look weak to their teammates, coaches, and other stakeholders involved in those sports. And then the second was that Black athletes more often reported, compared to their white counterparts, that they didn't know they had a concussion. They didn't have the knowledge that the things that they were experiencing, some of the symptoms they were experiencing, were even related to a concussion. And that really stuck out, because although we didn't see these big differences in terms of non-disclosure overall, there were still really pertinent reasons why people were not reporting. And those were significant findings for us to add a perspective to the data of why these things were happening when they did not report. So I thought that was really interesting, even though we did find some really awesome stuff in terms of equity, right? Coming into the collegiate setting and seeing some of those disparities decrease, there were still some really big reasons why some of our athletes were not reporting having a concussion.
So Tam, something you said really stuck out to me was that Black athletes did not even realize that they were having symptoms of concussion. Can you all talk a little bit about that? Like, why do we potentially see these differences between Black and white athletes as it relates to being able to identify concussion symptoms?
I think the biggest thing goes back to some of the previous research that you see in high school, is that it's the access, it's the resources. It's the big thing that sticks out to me as a clinician, is not having an athletic trainer there in the setting, mostly in high school, to give that education, to be there, to even be a resource for our student athletes. And that makes a difference. And I know that Dr. Wallace can really fill in for me here on this one, but it's really, it goes back and ties back into the social determinants of health. It's really about that access and the type of healthcare that is available for them, that you see a little bit changes when things are more on an even and equitable playing field in the collegiate setting.
Interesting. And the other piece was about not wanting to be perceived potentially as weak by their teammates. I don't know if you all completed an analysis like this, or if you all could potentially speak on this, but throughout the course of, I guess, a collegiate career, were freshmen potentially more likely to report weakness compared to some of the later counterparts throughout their junior and senior year? No, go ahead.
Sorry about that. I think that was one of the limitations that we stated within the paper, was just that a big portion of our data came from incoming first year students. And that may have played a role in some of the data, but that's not necessarily something that we can totally come out and say, because that's not something that we totally dug into, but that's an opportunity for future research for us to dig deep into that and find out what are those differences as you go throughout your collegiate career, what type of knowledge that you're gaining, what type of access and resources and things that you're learning as you continue your collegiate career.
Yeah, I think that would be just fascinating to know when we think about like assimilating to our environment and our culture, and seeing how it can change from, I didn't have access in high school, now I have this access in college, and what that looks like over the course of the collegiate career. And one of the things you all recommended was potentially exploring larger scale community-based interventions to try and mitigate concussion non-disclosure. Could you potentially discuss what this would look like, and how athletic training and the athletic training community can fit into this intervention model?
Yeah, sure. We really try to emphasize this a lot within the context of our results, especially as we're comparing what we found in high school athletes compared to collegiate athletes, right? And so we really emphasize that health disparities framework, which that means what we're doing with research really is to first detect differences. Then we need to understand those differences. And ultimately, the work that we're doing needs to translate to reducing and mitigate any differences that we see, right? So if we look at concussion research as a whole, really a lot of it is done in communities with a greater access to resources. as a scientist, as a researcher, when there are people in the community to help you do research, that makes things easier. And unfortunately, there are many communities that within the United States that are marginalized and just have no resources. And so when we're talking about research and really what's been done, there are many communities that have been left behind, right? And so really, as people are and communities are operating with minimal resources, this means that injuries like concussion, and not just concussion, a lot of us that have authored this paper, we do concussion research, but I think this can translate to any type of injury, orthopedic or healthcare issue. It really means that there's a good chance that a lot of things are going unreported, undiagnosed, and they're slipping through the cracks in healthcare, right? So what we're trying to do is really emphasize that for us to make changes and propel research forward, we have to get into communities that have been historically excluded and that are maybe a little bit harder for us to reach as researchers, right? So it's really going to take intentional efforts to get involved, doing community-based work, and then designing interventions and programs that are going to mitigate disparities, ultimately within this framework, reducing disparities, narrowing gaps. And that's going to really include approaches that are using a health equity lens. So what we do in one community might be very different than what we do in another community. So really including this translational approach to our research, not just examining differences and then leaving it at that, really digging deeper so we gravitate to making changes and reducing these gaps. Personally, in almost everything that I do research-wise, I really like to emphasize the presence of an athletic trainer. I think at the community level, an athletic trainer is one of the most powerful healthcare providers that can help to mitigate and reduce disparities. When there is presence of an athletic trainer for our physically active population, that person can do a lot in terms of providing resources, healthcare, and then helping patients navigate the healthcare system, right? So I'm always a huge advocate of athletic trainers in this sense to really be involved. And that goes with, we know that there are many communities that don't have access to an athletic trainer, and to keep pushing forward and emphasizing the importance of an athletic trainer and equitable access to an athletic trainer. Tam, I'm sure Tam has something to add there as well.
Yeah, I'm just thinking about how exciting it is to be a part of this particular project, because I remember looking back at some of the high school data and being like, man, what if, some of these kids had access? What type of healthcare would they have right now? And it just, it brings me joy that this is the type of stuff that we're figuring out and finding out. But now it's the part of like, we need to take action and make sure that we are giving this access, because our high school athletes are going to become our collegiate athletes, right? And some of them may be behind the curve. How do we fix that? How do we accommodate them earlier? It's by exactly what Dr. Wallace was saying, like collaborating, pushing for athletic trainers, being in high schools. We provide great healthcare. We're a resource that, I think that they deserve. You know what I mean? And so I think that the goal is to take this equitable lens, right, and start applying that with real action. And it's going to take all of us to keep pushing that forward.
I can feel the joy and excitement through the screen, and I'm like just as excited because I think just what you mentioned about across other injuries, orthopedic injuries, musculoskeletal injuries, we see that there's probably this issue occurring in all of these different populations. I guess my question is, it sounds like there has to be some intentionality with targeting these different communities in order for us to improve access, in order for us to really identify that these are problems that are being there. Just as you mentioned, potentially diseases and disorders that are being undiagnosed. Just in general, do you have recommendations as researchers are trying to be more inclusive with their samples and trying to get into these communities to get them involved in research? Do you have any recommendations for researchers on how they can start that process?
Yeah, so my biggest recommendation is developing relationships and being present. So for us in academia, that can be challenging, right? Because we're up against a lot of different things in terms of what our job description includes, and writing and publishing and meetings and everything. This can be hard. However, there has to be intentional effort to really get involved in the community. For us to really make change, those relationships have to be made. They have to see you. They have to trust you. And that includes showing up. Right. And so you have to build those things into your schedule. If that's something that you really want to do, if you really want to make the change, then that's just something that you have to be intentional about. It can't be as simple as dropping surveys off, picking them up. You have to be present and do the boots on the ground work and make relationships, making relationships with. So I do a lot in high schools, right? So high school administrators, coaches, the athletic trainers, if they're present, the athletic directors, the athletes, the parents, and just being open, because those relationships are just going to lead you to other projects. And then you really build that community atmosphere where you're really working together and you have a lot of buy-in from everybody to mitigate these problems, reduce these problems.
So not just at that individual level, but also in interpersonal and community levels, and targeting from the top down and bottom up to try and really get into those communities. That's really a great advice for clinicians and researchers like myself that want to be a bit more intentional with our recruiting. So along the lines, as relates to clinicians, what recommendations would you have for a clinician to be cognizant of these different types of social determinants of health in their practice?
I think as a clinician, it also goes back, I'm literally just piggybacking off of what Jessica just said, but it's about the relationships and then letting the research inform our clinical practice. Things are changing. The demographic and makeup of our collegiate athletes is changing, where a majority of athletes participating in particular sports, and I know we're talking about concussions here, where a large population of our athletic population that play in risk, like high concussion risk sports, are Black athletes. And what does that mean? And what information do we have from the research that'll help us be better clinicians for all of our athletes, right? Patient-centered care wise for them individually. So I think it's really about forming relationships with other researchers, calling them, texting them, asking them how you can be more involved. I know that's kind of scary from the clinical side sometimes, but I know that I want to be the best healthcare provider that I can be. And I know that the researchers are the ones that are helping me inform my practice. So that was the first thing that I wanted to say before we moved on. But in terms of social determinants of health, I think it also goes back to what Jessica was talking about, of being aware of those disparities and then trying to figure out and evaluate the current procedures and policies we already have in place that are supposed to have those interventions to prevent some of those things, and saying, are we doing what we think we're doing? Are we providing the care we think that we're providing? And if not, how can we structure the things that we're doing to improve the interventions that we have so that we are providing better healthcare for all of our athletes based on their experiences living this life, going through life, and being a collegiate athlete? We're all about helping and aiding and accommodating them, but let's do it to the best of our abilities to make sure that we're doing it specifically for them, that it's patient-centered. And it's not this one size fits all, let's just do it like this because that's the way we've been doing it. But again, piggybacking back to letting the research inform our clinical practice.
I really appreciate the evidence-based practice commentary that you're providing. I also think researchers, we also have to be cognizant of making sure we're doing research that can help clinicians inform their practice as well. So I think it can go both ways. So it was really exciting to read this paper and to see this collaboration between clinicians and researchers coming together to make some changes. My last question is, if I were to walk into my athletic training facility today and I wanted to make an immediate change, what recommendation would you provide for me?
I would say, I think it's doing the work up front. And I don't know, I think that being an athletic trainer, everything we do is about having a relationship. So I feel like I'm just repeating everything that Jessica was saying, but when you have a real rapport with your community, with the people that you're collaborating with all the stakeholders involved in your sport or within your clinic, whatever it is, wherever you're treating people, it's all about the relationships. You have to do the work up front. You have to learn their background. You have to learn where they come from, how they do things, how they see this world and how they're walking in it. And you have to have an appreciation for that. And then you have to say to yourself, what am I doing to make sure that they're having the best experience possible, that they're getting the best healthcare possible? And it's a lot of like critically reflecting what you're doing as a clinician as well, and seeing where your weaknesses are and those things like that, and just getting better as a clinician to help you be a better healthcare provider for your clientele, for your patients, for your department, whoever you're working for. But it's really, I feel like I'm just repeating myself, but it's really about the relationships and doing the work up front.
So potentially going into my clinic and having that hard conversation, or having just an initial conversation to try and learn about someone's background that maybe I didn't know previously.
Yeah. Sorry. What I would say is that, with any approach, really make sure that there are genuine intentions behind it, right? So, within the context of this work, we're doing it because we want to shift practice. We want to change the lens and the way people are maybe approaching things. And ultimately, we want to provide better healthcare and change people's lives, right? So having that genuine approach, back to what Tamara said, trust and relationships are number one. And so whether you're doing something to guide clinical practice or to incorporate something into research, really have genuine intention behind your purpose.
Definitely appreciate that message too. Tamara, Jessica, do you all have any last minute thoughts, anything that you really want to communicate to our readership?
I feel like as a clinician, sometimes it's a little scary to hop into the research world and academia, but it's been one of the most fulfilling things that has happened to me, and I have such great relationships with athletic trainers who are doing a lot of the research, again, that informs my clinical practice. And going back to the relationships, it's all about reaching across the aisle and collaborating to make our profession better, and to also teach others that we are really important healthcare providers. And I know that now more than ever that people are starting to realize how important we are and the things that we do. And so I think just doing our very best each day and trying to get a little bit better, and just doing a little bit of work will make huge strides in how you're taking care of your student athletes.
I echo everything that she said. And I guess my last message is, just keep advocating and pushing for equitable access to athletic trainers. So, I'm really a strong believer that presence of an athletic trainer is one of the best ways to reduce healthcare disparities, because that translates to the healthcare of our adolescents, our youth, but then also communication to parents, coaches, administrators, kind of that community-wide relationships.
I think those are both great take-home messages, and I hope that those watching this podcast or listening to the podcast or watching the video will take that to heart as we continue to try and figure out how we can enhance care for our patients. So thank you both so much for joining me today. As a reminder, this article is available free of charge by the Journal of Athletic Training. I highly recommend everyone go and download this current manuscript when it comes out in an upcoming issue. Again, thank you both so much, and we will see you next time.